Hey guys, how you doing? It's Ed from The Animus here, just making a quick video. Been working on some stuff for school. Any of you guys read The Chrysanthemum and the Sword? Let's see if you can see it there. By Ruth Benedict. It's a great anthropological look at the society of Japan from someone who had never been to Japan. It was written in 1945, or published in 1945, I should say. It's quite the interesting read. I'm using it on my final research paper on martial arts in Japan. Anyway, that's not what I'm making a video about. I was on Reddit earlier and I saw a post regarding the national health care, and I wanted to make a quick note on that. National health care, to me, is something that America lacks. And when I was in Japan in October 2010, part of studying abroad, I was there longer, but when I was there in October 2010, I was actually hospitalized for 2 weeks with bronchitis. Now, I have a condition that makes me more susceptible to getting sick, and when I get sick, it's a doozy. So I went to the hospital not knowing anything that would happen, and I ended up not leaving for 2 weeks. This was a hospital in Tokyo. My doctor spoke English, and that was about it. I mean, there was no internet. It was a terrifying time because everyone around me was speaking Japanese, and at the time my Japanese was quite poor. Still is. And here I am, you know, this, I was 24 at the time. 24-year-old American kid, just, like, lost in Japan in this hospital. But anyway, the whole thing ended up costing me about $800 because I had the national health care. As a student, it cost me about $9 a month to pay for it. Here in America, my health insurance costs me $80 to $100 a month, not including the cost of prescriptions and things like that. On top of that, it costs me quite a lot. Now, after going to the hospital in Japan, when I came back, I went to the Shiakusho, the local municipality office for the city I lived in, and they paid me 7,000 yen a month to live there because of medical expenses. Basically, that would cover any cost of me going there if I had to pay for the prescription, which I didn't have to pay for once I got there, and all this basically for $9 a month. That is insane to me, that I paid only $9 a month and I got all that. Yet here in America, we can't get anything like that. So this is just a quick video. The guy was asking whether or not, you know, he should get his company's insurance or the national healthcare insurance. And this is my question to you guys. Those of you that work for, you know, ALT or a company in Japan, what do you guys think in terms of the difference between national healthcare and the company healthcare? Which one is the benefits? This is actually an honest question because for me, it seems like the national healthcare would be the way to go, considering in the end result of me going to the hospital was them paying me. And had I had this particular the service before I went to the hospital, it would have paid for the hospital itself almost. So had I been in America when that happened, it would have cost me maybe a couple $100,000. $800 compared to a couple $100,000. Yeah. Crazy. Anyway, that's just what I wanted to make a quick update. JLPT is coming up in less than 2 months. If you haven't started studying, please do so, because damn, it's coming quick. I've already been doing those books that I introduced a couple videos back, and they're kicking my ass, so it's a good thing, man. Alright, Ishuni Gambarimashou. Later, guys.